Welcome to Physicians Who Lead, the podcast where we sit down with physician leaders who are shaping the future of healthcare. Each episode, we dive into the real challenges facing our system today and hear directly from the physicians leading the way with innovation, resilience, and vision. If you want to understand how healthcare is changing and meet the leaders driving that change, you're in the right place.
Hello, welcome to the Physicians Who Lead podcast. Sorry, we're having a rough day today. Today, my guest is Dr. Keith Smith. Dr. Smith is an anesthesiologist clinically and is still practicing clinically, as well as leading the largest surgical center in Oklahoma City. Dr. Smith, welcome to the podcast.
Thanks for having me.
Yeah, I'm excited because you and I have talked before, and I think you're doing some pretty cool stuff. So can you tell us a bit about your career to date?
Sure. I'm an anesthesiologist. I've been in private practice since 1990. I was recruited to Oklahoma City to join a private practice group, and they were very busy. They needed help with cardiac anesthesia and some pediatric anesthesia. So I got busy in a hurry and discovered very shortly after I started practice that something was wrong. Something was really terribly wrong, and that in order to continue to participate in taking care of patients in this industry, I had to do something different. It was like being an accessory to a crime. Not that long after I started, just about 7 years into my practice, along with another anesthesiologist, opened up an outpatient surgery center so that we could control not just the medical experience, but also the financial exposure patients had for care. So it was a very eye-opening experience to open the facility, to deal with patients financially very directly, and to discover that we could charge 1/10 of what the so-called not-for-profit hospitals charge for the same service, I would argue, delivered in a better way, and still make money. I began to realize that the free market, as we like to think about it, the competitive free market, and one which I think that a lot of physicians would claim to support, is really not operational in a functional way like it is in other industries. And I'm an unapologetic advocate of market competition, really in an uncompromised, radical way. Because of that, I think that was part of why I left practicing in the hospital system. And then once I opened up our own facility where I had control, I began to ask a lot of questions. First and foremost being, our reputation is solid, pediatric fellowship trained. I'd anesthetized the children of most of the business leaders in the whole area. Why don't insurance companies want to work with us? I mean, we took care of all the Division I athletes at the time. Our reputation was just phenomenal. So, and we were cheaper. So, if you're cheaper and better in any other industry, you tend to own all the others.
Yeah.
And we were shunned by insurance carriers. And that's when I really began to ask some questions and start to seeking.
Obviously the free market, is a great concept. I think what I'd love for you to share is the scope and the size of the surgical center, so people can realize that, it's not a 3 or 4 person entity that's doing this. Like, you're running, a full surgical center this way.
Yeah, we started in a small way, in a 3.5 operating room facility. And if anybody ever wants to follow our lead, I always coach them. We weren't always what we are now. We started off very small, but the scope of our facility now is large. There's 146 surgeons on staff. It's multi-specialty, 34,000 square foot facility. So what we are doing now ranges from bilateral cochlear implants on children that are just a few months old to total knees, hips, reverse shoulders, big orthopedic cases, hysterectomies. We're going to start doing colon resections next month. So it's a facility with a wide scope a multi-specialty scope, an anesthesia staff that myself, say it's about my partners, very talented, cardiac fellowship trained, pediatric fellowship trained, comfortable with very sick patients and also um, uh, children, as young as 4 or 6 weeks old. That's not, we don't do that every day, but we're very, very comfortable with that. And yeah, it's a large facility. Takes care of patients from all over the United States too. I would say that's the other scope. About 50% of the patients on any given week travel to Oklahoma City from out of state or out of the country to have surgery. So we've also developed and have been fortunate to receive some national media attention that has helped our footprint so that people from all over the place can find us, search our website, find the price for the procedure they require, and receive it in a way that doesn't bankrupt them.
Now, do you find that the free market process makes it easier for you to recruit physicians? Because I hear a lot of physicians complain about interacting with insurance providers.
Well, and to be clear, for me, there is nothing about working with an insurance carrier that is antithetical to market competition.
Okay.
It's just that the insurance carriers do not want to work with a facility that is low cost and won't give them a fictitious bill like a so-called not-for-profit hospital will. The fact is we can charge 1/10 of what the not-for-profit hospital charges, shave the profitability of the facility down dramatically, and then put a large part of that amount of money in the physician's pocket. So
Right.
even at our pricing, say $1,836 for removal of a gallbladder, the portion of that goes in the surgeon's pocket is larger than any other entity that he deals with or she deals with that pays them. So they actually do better at a lower price. And it's because my philosophy is that I think the people who do the work, the clinicians, the nurses, scrub techs, I think they should do well. And we don't treat the Surgery Center of Oklahoma as an institution, as a generate profit entity. It is a tool of our practice, which we use to deliver the highest quality care at a price that the patients can afford.
You're still practicing clinically, but you're also leading other physicians. What is it about your time at the bedside that's led to how you lead and left an impression on you?
Yeah, I don't really, to be honest with you, I don't think of myself as a leader of physicians. There are people that have watched what we have done. And again, what happens at Surgery Center of Oklahoma is a team effort. It's not just me. I mean, there are surgeons that have confidence in me and operate in such a way that, with such high quality and almost completely devoid of complications or infections. So surgery is a real team effort. If any, this is a vision that I would say that my brother from another mother, Steve Lantier, my anesthesiologist buddy who started this with me, it's a vision that we have providing high quality care at an affordable price. And if that vision has led other physicians to consider doing the same thing and copying us, and it has, then it's what we've done. My time at the bedside, I think it was when I was looking a patient in the eye, and I realized back in the old days before we started the surgery center, I don't know how I would have a conversation with them and keep a straight face
Right.
about the charges that I'm going to issue to their insurance carrier. I've got to look a farmer from Western Oklahoma in the eye now and say, listen, I'm going to charge you and your family $3,100 for a tonsillectomy, and that's surgeon facility anesthesia. That's all in, and I have to do that with a straight face.
Yeah.
And I have to be prepared to defend that. I am happy to defend that because I happen to know that across town it's 30,000.
Right.
Recently, a family in the Dallas area was quoted 72,000 for a. So people flee, that kind of abuse. And I think it's when I'm face to face, when I've been face to face with patients and I understand that, they have a story to tell of a prior experience where they were nearly bankrupted,
Right.
I feel vindicated in our approach. And if other physicians face that situation, they hear patients tell those stories and they know about what we have done. I posted the website with all the prices in 2009. If physicians know that story and now they know that we've been successful and that leads them to copy us or to at least give that some thought, I would say that is the foundation of any kind of leadership that I.
So, I mean, the curiosity, it's a digital world now, right? So, people can see your prices in all kinds of different hallways of all kinds of different hospitals. Have you received any sort of negative pushback around starting?
Yeah, you think? Well, yes, we have. Not as much as we used to, but as you can imagine, I post a price that is a tenth of what a not-for-profit hospital has just charged someone and charges people daily.
Yeah.
Yeah, they didn't like that. And I spoke loudly, vocally about why wouldn't insurance companies want cheaper and better? Insurance companies didn't like that. They didn't like that one bit. So yeah, we were tortured by the legislators, by our own health department. We've been targeted by everybody you can imagine. Interestingly, when we stopped filing insurance claims, when I just decided we were going to secede, we are going to back out of this entire system, not even attempt to deal with the insurance carriers, not even file out of network claims. And we've never accepted a dime of money from government. When we stopped filing out of network claims, a lot of the pressure and heat went away. It's like we were completely off their turf. So they kind of left us alone. Not entirely, but they kind of left us alone. But they came at us every which way. You greedy physicians who own your own facility. I said, how am I greedy? I charge a tenth of what you do. I mean, on and on. But yeah, we were able to withstand just full frontal assault, nonstop, really until about 2009, 2010. We opened in 1997, so it was a decade of me going to the state capitol here in Oklahoma and even to Washington and just saying, just leave us alone. Let the market work. We'll show you what it'll do. It'll bring prices down and bring quality up like it does in every other industry. And that's what's happened. And having said all that, I've got to give credit where it's due. The legislators in Oklahoma, by and large, left us alone. Some of them did not. Some of them, of course, were just paid apparatchiks of the cartel. And they're going to, follow their marching orders and just torture whoever they point the finger at. But by and large, the political climate in Oklahoma allowed us to do what we've done. And I posted the prices online in 2009, and we didn't get any pushback for that. And it wasn't until people really started to notice us and the hospitals then had to account for why do we charge 10, 15 times what they do, that I had to get back in the ring and defend our concept.
Right. Now, the other piece is you operate considerably leaner than a hospital would, given that you're a full-time anesthesiologist and the medical director or CEO, right? So, that's a factor that's gonna come into prices and stuff like that. I don't know if it's necessarily tenfold. I'm not doing that to defend anybody, but but it's interesting. Now, you also speak on the free market system elsewhere, right? Did you not create a book about it?
Well, I haven't written a book about it, but I co-founded an organization called the Free Market Medical Association with my friend Jay Kempton, who he owns and operates a third-party administrator. And for everybody listening to this, that we call this a TPA, third-party administrator. And if you're an employer who is sick and tired of Cross United, Cigna, Aetna ripping you off every year, giving you renewals, that are just astronomical, and this year they're going to be particularly high, then you decide, some of you, to self-fund. And that means I'm going to self-insure. or self-fund. It's the same thing. And that means you are going to take the risk instead of pay someone like Blue, United, Cigna, Aetna to take that risk for you. So instead of sending 100,000 a month to Blue Cross, you send 100,000 a month to a fund which you control. And then you hire someone that will hold the checkbook and pay the bills. That's what an independent third-party administrator does. Now, to confuse things, Blue, United, Cigna, Aetna act as third-party administrators. And when you're a physician and you receive the patient's Blue Cross card, in all likelihood, that's a self-funded plan. But you wouldn't know. It's going to look the same either way.
Okay.
But they're independent third-party administrators, and Jay Kempton is one of those in the country that owns and operates one. So he has a lot of clients who have decided to self-fund, and when they realized after a very short period of time that they were going to save millions of dollars by buying directly from me and the others that have copied me, that created kind of a movement. Jay Kempton saw an opportunity to form an association where, we could get together, share ideas, war stories, resources, encourage others to do this. We formed the Free Market Medical Association, and it's a very economically grounded organization. We take our lead on economics from the most radical and principled school, the Austrian school. It's very steeped in property rights. And so it's been a real eye-opener. It's been a good educational resource for, I think, a lot of physicians and facility administrators on how, what is the free market? What does it look like? What does it mean? Define this. And ultimately, it has taught a lot of people who previously thought capitalism was about getting all I can get. It's really not. A market that is a competitive market and a true capitalist is one who wishes for a mutually beneficial exchange, where both parties walk away from the exchange better off than before. They walk away from the exchange with the idea that if I need to buy from this person again, I will. So it feels mutually beneficial, not like a hit and run, like you feel if you go to a big hospital system. So the Free Market Medical Association promotes market competition in the most radical way. And in a way, I would argue that even makes a lot of physicians uncomfortable at first until they come to grips with it.
I can see the fear of downward pressure and stuff like that. But it's, there's enough need for medical services that I don't think you're going to see the push towards a point where it's not financially feasible and sustainable for physicians, right? So
that's a phrase that a lot of physicians that are uninitiated with the Free Market Medical Association and these concepts will use, that race to the bottom. And right. I hear that all the time. Well, we get real competitive. It's a race to the bottom. Well, that's a myth. I'm sorry. That's just not what it is. I mean, eventually you get to a price where no one wants to provide the service.
Right.
So you don't really have a race to the bottom. You have a race until someone thinks about exiting the market as someone who sells this particular service. But economists call that place the market clearing price. And that's a great concept because there's always an imbalance between supply and demand. And when you get to that place where supply is such that the demand almost matches it or does match it, that clears the market. In other words, the buyers buy it all up and the sellers are still happy to sell it to the buyers. So that it's a market clearing price is what ultimately occurs. Now, are there people who exit the market before you get to that market clearing price and say, I'm done, I'm not doing this anymore? Probably. But a race to the bottom is a myth, and it's meant to discourage someone from entertaining the idea that they need to participate in a competitive market environment.
It's interesting. And it's funny because I think I've caught myself using that phrase as it relates to the recruitment industry. So I might have to rethink that completely, right? Now, you've talked several times about how, the better price, better quality. How do you ensure the surgical center remains at high quality, and who do you report that to?
Well, that's the beauty of the market. If you're not any good, you go away. So in our world, in this industry, if you're signed up with United, if you're in network, you're going to get referrals because people are in network, whether you're any good or not. If you're employed and you work for a hospital as a surgeon, you're going to get referrals from the primary care docs that are employed by that hospital because God help them if they send a referral to a surgeon who doesn't work for that hospital.
Right.
So that's the world of guaranteed referrals, captured referrals. I love it that they actually refer to patients as captured. HMO started that when they said, we have so many captured lives. So there's so much more truth in that than you have any idea. Like, why don't you use Shanghai? I mean, let's be honest about this, or, kidnapped. So in my world, we don't have any insurance contracts.
Right.
We don't accept money from the government. If we're not any good, we're like a bad restaurant. A bad restaurant that serves poisonous food, they just disappear from the market. Yeah. We have the confidence in our ability, in the quality, and the value that we provide to put our money where our mouth is. And we say, here's what we do, here's how much it is, we stand behind it, and market judge us. And the market is harsh. The market judges you very harshly. So the greatest measure of quality is, will someone tell you how much they're going to charge? Because if someone can't tell you what they're going to charge you for a knee arthroscopy, that means they're uncertain. And now I'm giving them the benefit of the doubt. Someone may not tell you how much they're going to charge you for a knee arthroscopy because they want to make sure they get every dime out of you they possibly can. And they can't really get away with that until after the surgery. Let's assume someone is an ethical actor, and that is not their motivation. If they can't tell you how much, that means they are loaded with uncertainty. If they're loaded with uncertainty, that means their outcomes are not predictable. I will tell you. I won't tell you when you ask. I'll post it online. You'll notice on our website there are procedures that patients might want that are not there.
Right.
They're not there because I can't find or secure the surgical talent to perform those procedures. So I would love to do hip arthroscopy. There's a lot of demand for that. I don't have access to a good hip arthroscopist. I don't. And so we don't do hip arthroscopy because the last thing I want to do is perform a surgery and be awful at it, because that stains our reputation for everything that we do. So that's how we ensure quality. We have to. Our livelihood depends on it. Yeah. If someone reaches out to me and they need a hip arthroscopy, I send them to my friend Ben Dom in Chicago. I think he's the best. I think world. Why in the world would I want to do a hip arthroscopy when the best in the world is a 1-hour flight away from Oklahoma City? Right. There's just no reason for me to do that. And I can't do it because it stains. If we did it and the outcome is not good, it stains the reputation of everything else we do. So we are right up against the quality lens. There is no escaping it for us.
Right.
And that's really too creepy, I think, for a lot of physicians.
Yeah. I think it's just a different, physicians aren't trained to necessarily think this way, right? They're trained in systems and things of that nature, right? So if somebody wants to find you and get in touch with you about this model, what's the easiest way for them to find you?
Our Surgery Center of Oklahoma website is surgerycenterok.com. We're on Instagram, Twitter, and Facebook. We're pretty easy to find. I'm on LinkedIn. There are some very spirited discussions about what you and I discussed already, and I welcome those.
Yeah.
Everybody thinks that there's really something wrong with the U.S. healthcare system. There's nothing wrong with it. It's working exactly as it was designed to work by the industry big shots and people in government. What I represent is an alternative that is affordability, high quality, and puts smiles on the faces of all of the physicians involved. So, yeah, and the Free Market Medical Association is another resource people interested should check out.
Yeah, it's interesting. You mean having worked in Canada, having worked in the U.S. as well, like there's so many options out there that that people can look at for care, right? So I think the problem is that we don't know to look and stuff like that. I found you through LinkedIn, and this opened up an entirely new understanding of things, right? Like we even joked the last time we talked that Canadians are coming to Oklahoma to get surgical care, right? So
Right.
it's an interesting an interesting model that still provides profit for the center, provides great income for the physicians, and at the same time provides great care to the patients, right? So I it's something I'll happily watch to see and hope it grows and more centers open. So I thank you, Dr. Smith, for your time, and I will share this and links to the Free Market Association and stuff when I post this episode. So thank you very much for your time today, and I will keep in touch, and we'll talk again.
Sounds good. Thanks for having me.
Hey, my pleasure. Take care.
You too.